And Yamiche, I have to start with you. Your question to Donald Trump was dismissed as a nasty question. And, I wish that someone else had followed up on it. But can you just, from the reporting standpoint, just confirm for us, who is it that got rid of this office? Because Donald Trump is saying he knew nothing about it.
Well, it's the Trump administration. The Obama administration had this office set up after the Ebola crisis, and they had people specifically looking at monitoring pandemics, looking out for things like SARS or polio. And President Trump got elected. He kept it for the first 2 years of his administration. And then around 2018, he decided that he wanted to disband it. And what you saw was health officials, top health officials who are experts on things like viruses that are spreading very quickly. They left the administration abruptly. That was then that group was then disbanded, and it was never, ever brought back together, or there was never anybody that was replaced to deal specifically with pandemics. So what you saw was the president say, well, we had to save money, and that's why we had to get rid of this group. And today, when I was pressing him on why that happened, which of course this happened under his administration, it was John Bolton, the National Security Advisor. This was the National Security Council. He said he knew nothing about it, which of course is stunning, given the fact that if he's telling the truth, the president means that he just didn't know what was going on in his own administration. And if he isn't telling the truth, which seems more likely at this point, then you have a president who is just saying, well, I'm completely aloof and don't want any responsibility for this pandemic.
Yeah, and very quickly, just and first of all, congratulations to you on just standing up for yourself. I saw you trying to follow up, but we couldn't hear you. One of our reporters has said that what happens is that the mics get cut after the president decides he's finished with a reporter and doesn't want to talk to them anymore. In fact, was your mic cut after you asked the question?
That's right. I was trying to ask a follow-up question to say, well, it was your National Security Council, but you couldn't hear me because the White House cut off the mics.
Yeah, interesting. I just want to, just for the audience here, Beth Cameron actually served as a senior director for this office, the Global Health, Security, and Biodefense Office in the White House National Security Council, wrote an op-ed about the council being shut down. It was titled, "I Ran the White House Pandemic Office, Trump Closed It. It's impossible to assess the full impact of the 2018 decision to disband the White House office responsible for this work," she wrote. "Biological experts do remain in the White House and in our government, but it's clear that eliminating the office has contributed to the federal government's sluggish domestic response. What's especially concerning about the absence of this office today is that it was originally set up because of a previous epidemic, made the need of it quite clear. Pandemic threats may not arise every year, but the White House should constantly prepare for them. We can't afford for federal decision makers to waste time relearning old lessons, that they should be innovating and acting." And I want to ask you, Dr. Venkataramen, I hope I'm not pronouncing your name wrong. Why is it important to have had something like this, an office in place whose specialty was dealing with pandemics? What might have been different if we'd had that?
So I'm not a doctor, and you got the name perfect. But this team within the National Security Council played an important role. And I will say I worked with a group of external scientists who were also advising the president during that epidemic. And the critical aspect of that is to have a team of people who are giving the president credible scientific advice about an outbreak as it emerges, who are monitoring the situation abroad, who can be anticipating that impact as it comes to American soil. Now, what we know about the president and how President Trump has handled this crisis is that he has tried to ignore the advice of scientists and his own advisors, notwithstanding not having this team in place. And 6 weeks ago, when the first case was identified in late January in the U.S., he wanted to deny that this would be a problem. He reassured the public, saying this is nothing to worry about. It's only one person. He did not do what was necessary to deploy testing across the United States. And what we know about pandemic preparedness is that timing is critical because outbreaks grow exponentially. So in these 6 weeks where there has been inaction on the part of the White House, we have baked in a spread of this virus in the United States within our borders, a community spread within communities like Seattle, like Boston, like New York, that can't be put back in the bag. That said, what the president did today, I think for the first time, showed that he's taking this crisis seriously. And I do think what's important about what he announced today in in declaring a national emergency is that he's going to be able to mobilize about $50 billion towards building capacity in state and local hospitals and healthcare facilities so that there can be enough hospital beds for as this epidemic gets worse, which we know it will, and so that those boots are on the ground.